Welcome, and thank you for joining us today for the NCI webinar, Place-Based Strategies for Disease, Injury, and Violence Prevention. My name is Stephanie Myers, and I will be your WebEx host. Before I move into introducing our speaker for today, I'd like to make a few comments before we get started. All lines have been muted upon entry and will remain muted for the duration of the webinar. You can submit questions throughout the presentation in the Q&A or chat panel on the right-hand portion of your screen and select all panelists from the drop-down. We will ask them on your behalf during the Q&A portion of the webinar. If you need to view live captioning, please refer to the Media Viewer panel on the right-hand side of your screen. This webinar is being recorded and will be posted online in the near future. And now I'd like to turn it over to Dr. David Berrigan, Program Director in the Behavioral Research Program, part of the National Cancer Institute's Division of Cancer Control and Population Sciences.
Thank you, Stephanie. Currently, there's an intense interest in the social determinants of health as they relate to prevention, healthcare, and health disparities. So I am delighted to introduce our speaker today, Dr. Michelle Kondo. Dr. Kondo is a research social scientist with the USDA Forest Service in their Philadelphia field station. She received her PhD in urban design and planning from the University of Washington and obtained postdoctoral training in epidemiology at the University of Pennsylvania. Dr. Kondo and her collaborators have been developing a fascinating and important research program concerning neighborhood interventions aimed at violence, crime, and fear. These are topics that have long been considered important social determinants of health, but have proved somewhat difficult to incorporate into mainstream epidemiological and health research. So we are very excited to hear about the innovative research Michelle and her collaborators have been conducting. After her remarks, there should be time for questions, which you can enter into the webinar Q&A stretch, and we will read them out loud. So without further ado, here's Dr. Kondo.
Thank you so much for having me. As David mentioned, I'm a Forest Service scientist. And not many people are aware the Forest Service supports research, I think, in urban areas. And while there are around 190 million acres of national forests, which we manage, it's our primary mission, there are also nearly 170 million acres of trees and forests in urban areas. The Forest Service is committed to sustaining and protecting the health of our nation's forests to meet the needs of current and future generations, and I'm really pleased to be part of that work. So I'm stationed in Philadelphia, where a place can have a profound effect on human health. While some neighborhoods and some aspects of neighborhoods support health, others really detract from it. Philadelphia is one of many post-industrial cities dealing with the aftermath of many decades of decline in population and resources, and this has impacted some neighborhoods and the health of those residents more than others. I really like this model by Ana Diaz-Rue because it specifies that historic processes have led to segregation and profound racial or resource inequalities. And this is what has led to inequalities of the social and built environments. So whether it's housing quality, food security, availability of parks and green space, crime and safety, or social connections, these environmental factors are what you might call social determinants of numerous health behaviors and outcomes. So what is the solution? I rely on Frieden's health impact pyramid a lot, although as I will talk about sort of toward the conclusion, I think it may be time for some reorganization toward the base. The traditional medical model relies on counseling and education of high-risk individuals, right? So but this approach is often very costly and can be inefficient. It's easy to say, you should really stop smoking, stop overeating, start exercising, but it's immensely difficult for us to follow through if our environments don't support it. So instead, I think there's increasing understanding that it can be more efficient conditions and the context in which individuals make decisions. So we need healthy environments to make healthy decisions. And I ask in my research, can place-based or nature-based interventions improve public health and safety? I'll talk about two types of interventions pictured here that I have done research on. And one of them one of them has to do with urban nature. I'm going to talk this a little bit. So there's increasing evidence, I think by the day, studies are being published now, especially with the ease of access to big data, that exposure to nature is beneficial to human health on many fronts. And I've recently published a review of only experimental and longitudinal studies conducted in urban areas. And the Forest Service has also published a review focusing on urban nature and human health, shown here. I think it's a great tool. I see evidence of negative association between, I guess I would say robust evidence, negative association between urban nature exposure and mortality, mental health, stress, crime and violence, and as well as postoperative recovery, and positive association with attention and mood. I do really like to focus on crime and violence outcomes as well as stress in my research. So in Philadelphia, the built environment is very much characterized by vacancy. By some counts, there are about 40,000 vacant lots across the city, and these lots attract what is called short dumping, where contractors frequently are dumping their construction debris. We've talked with residents who live near these vacant lots, and they report that the lots add stress to their daily lives. The lots are often full of trash, if not, construction debris, weeds, also rodents, and illicit activities. So ethnographic studies that we have been involved in have found that these lots also play a role in the drug trade in Philadelphia, especially in certain neighborhoods. They often act as storefronts. They also found that weapons are often stored in cars that are parked in front of vacant lots. So we know that these lots play a role in community violence. About a quarter of these lots are owned by the city, and a number of cities are really taking efforts to address the many problems that come along with both vacant buildings and vacant lots. So I'm going to tell you about an observational study that I did with my co-authors of an abandoned building intervention. For example, in Philadelphia, about maybe 10 or 20% of vacant land has a building on it. So this is a major issue facing the city. In Philadelphia, the Doors and Windows Ordinance went into effect in 2011, which required owners to install operating doors and windows in all openings or face heavy fines. So we found that in some cases, the program led to renovations and sales of the buildings. So we compared changes in crime rates at buildings that came into compliance and that were renovated with crime rates around control buildings that remained vacant during the 4-year study period. And then just to give you an idea about how I built my panel database. So this is a series of maps. It's actually from another project, so the time period doesn't align with this one. But these are kernel density maps of point level, this is drug crimes, that we received from the police department. So over time, you can see that the number of interventions and match controls increase, those are the little dots, the green and the gray dots. So we assigned the crime density value to each of these intervention and control lots for each year of the project, and then, as well as assigned pre and post status to each lot. Results showed statistically significant reductions in all crimes and assaults and gun assaults, nuisance crimes as well around both types of property. So we ran models separately on the violation compliance as well as on renovation permits being pulled for buildings, properties. at the same time, we did see some increases in property crimes, robberies, and drug crimes around the violation compliance buildings. But I should say, nevertheless, this ordinance was challenged in court, and results from this study were included in an amicus brief in its defense, and the city recently won the case, actually. A randomized controlled trial of the intervention is underway in the city, and I'll talk a little bit more about that later. So vacant land is another major problem faced by many cities, and I think probably Detroit and Flint are the most well-known cases. A traditional method to mitigate vacant lots, I think that has really been pioneered by the Pennsylvania Horticultural Society and their land care program, involves cleaning and greening, where that's a term that I use to describe the process, where a lot is cleared of debris, and then grass and a few trees are planted, and usually a permeable picket fence is installed. And that's really just to prevent dumping, but not pedestrian entrance. So my colleagues and I have conducted a number of quasi-experimental or observational, and now some experimental studies as well of the effects of these types of interventions on crime, violence, on mental health, on social cohesion, and many other outcomes. And I'll tell you about a few. First, the Youngstown, the Neighborhood Development Corporation there, contacted us earlier this decade and told us about their Lots of Green program. And they suspected that they had been having an impact, had been making an impact on crime rates with the program, and they wanted help evaluating, whether or not that's true. So let's see, they had maybe cleaned and greened nearly 300 vacant lots, and they had two different versions. Version one is the traditional sort of contractor clean and green model, and I think that they had done this at about 170 vacant lots. The other version intervention, and that is where community members could apply for support from the city to do whatever they wanted with at a vacant lot, and mostly they were converted to community gardens or nearly 80 vacant lots. So we matched these lots with control. I think it was using maybe a 1-to-3 ratio. Control vacant lots that remained vacant throughout the study period. And you can see in this map that the intervention lots were highly clumped in two different neighborhoods, and I think this is a common strategy for cities trying to really stabilize neighborhoods. So we had to use some spatial models to address that issue. But we looked at many different types of crimes, changes in crime, so pre and post between the control and the intervention lots, and we found statistically significant reductions sort of across the board at all lots, but stronger associations and more consistent reductions in property crimes around the contractor clean and green lots versus stronger reductions in violent crimes around the community reuse lots, which is interesting and perhaps speaks to different maybe mechanism or pathway by which this type of intervention is having an effect on social patterns and behaviors in neighborhoods. I should mention that we also found significant increases in motor vehicle theft around all lots, which was interesting. And we also, started getting these questions about, well, are these interventions just pushing crimes away or just facing them to the next block? And so with this study, we began developing methods to test for displacement. And in fact, in our models, we found spillover crime reduction effects into neighboring areas, reuse lots. So this study in Youngstown, as well as prior studies conducted in Philadelphia, helped lead to a cluster randomized controlled trial, which was completed in 2018. And I will tell you about this one. So we started with nearly 600 vacant lots, randomly assigned to 3 arms, a control group, which was left untreated, a full treatment group that received the clean and green treatment only, and a partial treatment group that involved trash cleanup and mowing only. So there was a 38-month study period, and we used a difference in difference method to measure pre-post changes in crime and violence, between the intervention and control lots. In health outcomes, also, so using crime data as well as health outcomes from a survey of about 450 participants, also surveyed before and after the interventions, and from ethnographic observations. And this study was funded. PIs were Charles Brannis and John McDonald by NIAAA and NIDA and CDC. So here are some photos, before and after photos, to give you an idea of what the intervention looks like. And a map to show you the very random distribution of all of our vacant lots. And we found statistically significant reductions of 13% in crime overall, 29% reduction in gun violence, 22% reduction in burglary, and 30% less nuisance crimes in neighborhoods. And these are neighborhoods below the poverty line. And this is for all interventions grouped together. And then looking at the survey comparisons, or survey data, we found significant reduction in perceived or perceptions of crime, vandalism, and safety concerns. We also found significantly increased report of use of outside space for relaxing and socializing, which could point to some of the mechanism behind these changes in crime rates that we see. So in another analysis of the survey data, really focusing on mental health outcomes, we also we found significant decrease in depression and feeling of worthlessness for participants that lived near the intervention lots, although we didn't see change in other outcomes such as feeling nervous, hopelessness, restless, that everything is an effort, and poor mental health in general. And so, as I mentioned, I'm also interested in, in the mechanisms, how or why, what is the physiological mechanism that we might see a difference in health outcomes with these interventions. And I like to focus on stress. And I can tell you about one study. It was a small study, so I like to focus on this, and I've published a review of methods to do this, sort of real-time measurement techniques, where we asked 2 groups of residents in Philadelphia to take a walk around their blocks, and the lines show the walking route. And they took walks twice, so each group took 2 walks, pre and post intervention. And we asked them to wear heart rate monitors, or sort of as a perhaps crude indicator of stress. Heart rate monitors and GPS units, so that we could have we knew their heart rate as they were walking along these paths. And at the intervention site, the lots, the study lots were cleaned and greened using that standard method. And at the control site, the study lots remained the same. No intervention took place. And so comparing heart rates, we found an average decrease of up to around 16 beats per minute when participants were in view of the cleaned and green lots versus when they were in view of the control lots, whereas we found non-significant, really sort of negligible difference at the control sites. And we would like to do more studies like this. I also want to mention that, we have calculated return on investment based on the estimates from studies that we have conducted. One on this abandoned building study that I mentioned earlier, as well as on estimates from a vacant lot remediation study that was published in 2011. And it was of the land care intervention in Philadelphia. And we found that based on typical costs of about $1,600 per vacant lot and $180 per year maintenance fees, that based on cost savings from the prevented crimes or crime and violence, both firearm and non-firearm assault types, we found $26 in net benefits to taxpayers and over $300 to society at large for every dollar invested in the program. And these savings are a little bit more modest, I think, for the abandoned building remediation, just because the costs associated with that intervention are higher. And so thinking about long-term impact, so we get a lot of comments of, have you gone back to follow up and see are these effects long-lasting? And that's really difficult to do just because, it's difficult to ensure that the lots, remain as they're supposed to. Control lots remain vacant, and et cetera, and that the treatment lots remain, maintained and in good condition. So really difficult to go back and do more of a long-term study. Although I did, when I saw this study that just came out by Sanson, so he recently published results from a study of predictors of social mobility, which is, I think, likely strongly tied to health. But his study was based on a panel data set, including they collected income tax returns since 1989. They also had a citywide sample of children's blood lead levels, and they found that neighborhood toxicity was a stronger predictor of intergenerational mobility than traditional census-based measures, including poverty. And toxic neighborhoods, they find as having high rates of violence, incarceration, and lead exposure. So this neighborhood toxicity predicts lower income mobility and higher rates of teenage birth and incarceration. So, I think perhaps time to revise Braden's health impact pyramid down towards the bottom, perhaps that its context, changing context may be a more powerful way to improve health outcomes. And so they compared associations for white and black children and found that black children were exposed to toxic neighborhoods at a level not even experienced by white children. So some of the neighborhood interventions I think that I'm describing here could be powerful ways to reduce social and health inequalities. There are many more questions to be answered. We want to note, do these types of interventions in smaller cities have the same or similar effects? Vacancy looks different in different cities. So in Detroit and Flint, where vacancy may be the predominant land use versus in other cities where the parcel sizes are much smaller. So I'm part of a project funded by the CDC, the Youth Violence Prevention Center. We're studying vacant lot interventions, effects on youth violence, and that is run out of the University of Michigan under Mark Zimmerman. And we're looking at Flint, Youngstown, and Camden, New Jersey. Let's see, going back to abandoned buildings, that experimental trial that I mentioned is still ongoing, funded by an IAAA and PIs Charles Brannis and John McDonald. Let's see, I'm also supporting a study in New Orleans, and with the focus there of this study is on family violence, so the effects of blight remediation of neighborhood lots on family violence and youth violence, and looking at moderating impacts of community-level buffers. That is funded by the Institute of Child Health and Human Development. That goes to Catherine Teal at Tulane. And I am involved in other projects that are starting up, and I hope that we are able to locate support in Baltimore, Wilmington, Pittsburgh, and likely others. I think there are also important questions regarding practice. So there really has been no assessment to the state about who is doing vacant land mitigation or other place-based interventions, and how are they funded, what are their practical challenges and barriers, what tools do they need, and what has been or what is the return on investment of these efforts. I do want to mention that one toolkit that the Forest Service has developed in partnership with the American Forest and the National Association of Regional Councils. So this toolkit can give information about the why or the rationale for interventions, but also provides a toolkit to assess what they have, and we may be talking about cities or community groups, and talking about forest and vegetation resources, and then how to plan for future intervention programs. So I think tools like these and the study of them are also very important. Thanks everyone for listening. I would love to hear your feedback, questions, and thanks.
Well, thank you, Dr. Kondo, for just this lucid description of a fascinating and important line of research. And I encourage attendees to continue to type in questions that were inspired by this talk. And the first question that comes up is, could you talk some more about persistence of these effects? As you know, individual level behavioral interventions, you often have a beautiful response at the beginning, and then I happen to know that the subjects, like myself, just gain all the weight back after a year or two. So could you talk about where we're at with persistence?
Yeah, it's really difficult to measure that. So in terms of changing, if we talk about crime and violence outcomes and patterns, I think that's an outstanding research question to be investigated. To really, it would take a strong partnership with local community group and municipality to really ensure that the study lots sort of stay in as designated, intervention lots versus control lots. So I think it is an unanswered question, an opportunity.
I'll make a personal comment about that. A fear, and maybe a question also is, in some, I was thinking of sort of retrospective longitudinal studies, and I think of the Lower East Side of New York and the history of the greening of vacant lots there. But there how do you control for sort of neighborhood change that often accompanies these improvements via gentrification or increases in income? Have you thought about the study designs needed to address that?
Yeah. So, for example, in our observational studies, we do control for sociodemographic backgrounds, using census data over time. So so that's one thing that we do. And then in a randomized controlled trial, we as we are assigning our lots to groups, we certainly make sure that they're balanced in terms of those indicators. But for perhaps we assume over a 38-month period that you wouldn't see drastic change. But yeah, I think that there is room for some advancing that techniques to perhaps address that.
Super. The next question involves whether you have already or are beginning to look at this work in relation to obesity.
Yeah, we have, let's see, we have not focused on obesity in our survey questions or in the health data that we collected. Actually, we did collect. Our teams of data collectors did go out with scales and blood pressure cuffs, and we did not find significant difference in terms, if we're talking about the vacant lot intervention. In an earlier observational study, we did find that people reported exercising more often, but we weren't able to tie that to biometrics. So again, I think some area for future investigation.
Yes, and certainly some longitudinal studies of neighborhood deprivation have suggested a long time periods required to see an obesity signal, up to 10 years. So that may be part of a long-term follow-up approach. The next question is, could you talk a little about homelessness, if that's an outcome you're thinking about, or if there's evidence that, working on these vacant lots and other aspects of the community are influencing homelessness in any way?
Yeah, that is a good question, and I hadn't had any focused discussion or thoughts about that. But yes, it's a good question, and certainly we'll consider that.
Okay, they're coming in thick and fast now. Are there relationships between urban tree canopy cover and crime? I know Sullivan and Kuo did some work in Chicago, but their results were not repeated in Houston. So I guess urban tree canopy cover is a little more expansive topic than specific lot greening. So share about that a little if you can.
Sure. You can do longitudinal work there, but difficult because the technology to assess the urban tree canopy has really come into development within the past decade. So we don't have great comparable longitudinal, tree canopy data to use. As that changes, I think more that research will improve. But again, it's really tough to use an intervention or experimental approach with the tree canopy, just because of the nature of it. And so there have been many cross-sectional studies that find association between, urban tree canopy and crime. I ran a study of, it was a controlled case crossover study of gun assault victims, and we traced their paths, prior to assault, throughout their day and looked at tree canopy cover around the time of assault compared to, the rest of the other day, or compared to the environments of the controls. And we actually found tree canopy cover to be protective of in that study. So I think there is more opportunity as technology improves and we get more, ability to do longitudinal studies.
Tremendous. A listener asks, I've done work on alcohol outlet density and violent crime in Baltimore, so I have to ask if you looked at alcohol outlets in this work.
I can't say that we have. No, but I am familiar with that work, and but no, we did not think about that in the work that I have presented to you.
I wonder if that would be an interesting, extension project. You could link some GIS layers with alcohol density in the Philadelphia vacant-lot project and see if they acted as moderators of the effect of the lot revitalization. I guess the idea would be you'd see the impact blunted if there were a lot of alcohol outlets around the improved vacant lots.
Yeah. Yes.
And R21 waiting to be written.
Yes.
Another question, should we be looking at green spaces in our work? I'm not sure whether they're referring to in our workplaces. I presume they are, but if in workplace settings.
Definitely. Some of these stress studies were conducted in places, with employees, and so some employees were assigned to the, indoor reading group, and others were assigned to the, go out and take a walk group, or the gardening group, lunchtime gardening group. So yes, some of them do. I didn't generalize and I didn't find patterns there, but it's more sporadic. So yeah, I think that we are starting to think about workplace settings.
You alluded to the reductions in heart rate when people walked by green spaces, but what are some of the thinkings about mechanisms that these green or clean exposures have for improving mental health?
Yeah, let's see. Well, when I go into these neighborhoods and have asked or talked with people, there's one person said to me one time, and it just stuck with me, that, when my neighborhood is neglected, I feel neglected. So I think that these types of interventions that signal sort of care and ownership and care about a neighborhood, about a place, that it extends to extends to individuals and their feelings about themselves. Let me think. What else? So I think that also that these lots, again, based on what we've learned from our ethnographers, that the lots play a role in crime and violence and victimization, and so I think they give people anxiety. They make people afraid of perhaps being attacked as they walk by. The weeds and the debris can hide people, so they incite anxiety, and there are a lot of studies that show that mood is enhanced, mood and emotions as well, enhanced by green vegetation, especially when compared to exposure to urban cityscapes.
I think fantastic. So many exciting research questions there. And so I'm going to take the liberty of asking one more question. I think the stream of questions online is slowing. And so it occurs to me that quite a bit of this work has been sort of in less sprawling urban environments, somewhat in the East Coast, although I know New Orleans. And I wonder if you think that sort of density plays a role, because I know some Western cities also have vacant lots. I think of El Paso or Phoenix. But is this specific to a kind of a dense environment where there's a lot of kind of contact with all these little pieces, or would it apply across the board?
That is a great question, and would make for another great proposal. I think that this type of research, we are testing other environments with our work in Flint, for example. Looks very different there, much lower density than in Philadelphia or, say, Baltimore. And so we may see a difference there. But, right, the American Southwest, the American South, there are a lot of questions about, whether these findings apply generally or not.
Tremendous. Well, this has just been fantastic. So thank you so much. You can count on me to pester you again in the future. And Stephanie will remind people of the what's next in terms of the posting the webinar and what have you. So thank you again.
Great. Thank you.
Thank you so much, Dr. Kondo. I want to be respectful of everyone's time. We are coming up on the hour. Again, thank you for your patience with our technical difficulties earlier today. As I mentioned earlier, the presentation will be posted online in the near future, so be looking out for that. And if you have any questions, please reach out to us. And thank you again for your participation. Have a great day.